setting by either obstetrician or women's health nurse practitioner. Cervical cancer cells can occur if the cells become abnormal and grow out of control over time, and then they invade the cervical tissue. Most cases of cervical cancer are caused by the HPV virus, which is a popular virus that is transmitted through sexual intercourse. There are several different types of HPV virus. Some types can cause genital warts. They're low grades, and then they have a mild infection, and then there are high grades that cause a more serious infection. It used to be once you became sexually active, you would have to get a pap smear. So they've changed the guidelines that now you have to be 21 years old to get a pap smear. If your pap smear is normal, we do it every 3 years. Some physicians in a high-risk population, they still do the pap smear every year. So if you're 30 to 65, you get a pap test and an HPV test every 3 years. If you're under 30, we don't do the HPV test. We just check the cervical cells. And also with the pap smear for women under 25 and under, we can also do STD screening with the pap smear. We can screen for gonorrhea, chlamydia, trichomonas, and things like that as well. All of the same pap smear. And after 65 and over, the screening should stop. You don't need to get a pap smear anymore. Some women that have hysterectomies, they don't need a pap smear anymore unless the hysterectomy was something, they had uterine cancer, then you can do a vaginal pap smear. So the vaginal pap smear, you're checking the vaginal walls for any cervical cancer. Abnormal test results. So when you get an abnormal pap result, sometimes you have to get a biopsy. So those biopsies are called like a colposcopy. That's something that's done in the clinic. You insert the speculum exam and you're taking a biopsy out of the cervix. Causes like mild cramping or pain. Most younger women, if they have an abnormal pap smear, they don't have to get a colposcopy biopsy right away. We're just gonna watch it and see if the body can recover on its own. Most of the time, if you're young, got a good immune system, the cells just become normal on their own. Okay, and so we also do breast exams as well. So first we start with a self-breast exam. Normally you do once a month, 2 to 3 days after your period. Most people do it in the shower, and you wanna take the pads of your fingers. You wanna rub across the entire breast. You wanna check the nipples, looking for any nipple discharge. Even though the guidelines say that, you should check your breast, the clinical breast exam should be every 3 years. We do it every year. I make sure that each patient knows how to do it. You'd be surprised, some patients don't even check their breasts. They don't know how to check it. So each patient, we normally teach them how to check their breasts once a month. So yeah, the clinical breast exam is something that is done in the office. And we started about age 20. So we do a clinical breast exam. So if we feel anything that's abnormal, a lump, or anything like that, we send them out for a mammogram. If they're under 30, they just get a breast ultrasound. Okay, so screening mammograms, those start at age 40. If you feel like a suspicious lump during a breast exam, you make an appointment with your healthcare provider, and then she'll refer you out for a mammogram. If you have a first-degree relative that is diagnosed with breast cancer, like your mom, sister, or daughter, you have increased risk of breast cancer. So most of those women, they start a lot earlier getting mammogram screenings. So say like if your mom was age 40 when she was diagnosed, her daughter would have to start at age 30 to get mammograms. So they always start a little bit earlier. Okay, so the mammogram results range from 0 to 5. If you get a 0, that means more information is needed. So maybe they need like your prior scan before. So say like if some people go get a mammogram from different locations, most of the time you need all of the scans together so that they can compare the two. A 1 is like a normal result. So then you just repeat your screening in 1 year. 2 is like benign conditions. Some women have cysts in their breast. That doesn't mean it's cancer. It could be like a benign cyst, called fibrocystic breast. So they still get screening in 1 year after that. So if you get a 3, that means it's something that it's not likely cancer, but they want to follow up within 6 months. If you get a 4, that means that's suspicious for cancer, and then you have to get a biopsy done. And number 5 is highly suggestive of cancer, and they get a biopsy as well. Okay, and for women that's over 50, we do like colon cancer screenings. Some women, we can give them like the fit kit or something, their card that they take home. They put a stool sample on the card and they bring it back to the lab or the office. So colon cancer could be abnormal growths in the colon. Sometimes they looking for polyps that can turn into cancer. So your age, women and men who are age 50 to 75 should be screened for colon cancer. So like I said before, we start with the fit kit. They take it home, they put the sample on the card, they bring the card back. Most of the time, they start with that. When you mention colonoscopy, most patients don't like to do it because they have to drink the drink to clean out the bile. And then a tube is placed into the rectum to check the entire colon for any polyps and things like that. Most of the time, if it's normal, they have to come back within 5 to 10 years, depending on their risk factors, to repeat the screenings. So for like calcium and vitamin D requirements for women, if you're age 14 to 18, you need 13 milligrams per day. 19 to 50, you need 1,000 milligrams a day. And 50 and over, you need 1,200 milligrams per day. Women that's over 65, if you're at risk for like osteoporosis, most healthcare providers would recommend like a bone density test to check your bones. If you have high risk, if you fall or have bone pain and things like that, we send them for a bone density test. For men age 45 and older, they get screened for prostate cancer. So in the office, the doctor would insert a lubricated glove finger inside the man's rectum to feel for the prostate. If he feels anything abnormal, then they do the PSA blood test. And that's a specific antigen test that measures the PCA in the blood. Men with a higher level of the PCA have a higher risk for prostate cancer. And that's it. Any questions?
With the mammograms, oh no, with the fibrocystic disease, people who complain of pain, is there any recommendations that you give them, because there's really no treatment for it? So what kind of recommendation if someone has a fibrocystic breast? Is it a diet or any medications?
Oh, for fibrocystic breast?
Yes.
Some people, some people take like the pain medication, or sometimes they do like pain medications like ibuprofen to help with the pain. Some people do birth control pills to help with the pain, because a lot of times it's associated with your period when you get like engorged breast. And that probably makes it worse. It could be caffeine, chocolate, that contributes to breast pain as well. So I would limit the caffeine and chocolate and things like that.
There's a question, Ms. Applewhite. The first question is, are there cases where men have been diagnosed with breast cancer? And are men required to do breast exams?
Yes, men are required to do breast exams. Well, I know men have been diagnosed with breast cancer. I just have female patients, but I have heard of some patients that said like their father was diagnosed with breast cancer. So the woman would still have to get screened as well because she would still be at higher risk.
Okay, and the next question is, can you request a fit kit for the colon cancer screening? And what determines if you receive a kit as opposed to the actual procedure?
Most people, they start with the fit kit. If it's, you're really supposed to get both, and you can request one. If you have blood in your stool, you can request one. At age 50, you can request the fit kit. The fit kit, you do that first, and then you get a referral for the colonoscopy. So the fit kit is positive, you definitely have to get a colonoscopy afterwards.
Okay, there is a question. For those that have fibroids, can you explain what they are and when they should be removed?
Fibroids are benign mass in the uterus, which is very common, especially in African American women, definitely after age like 35 to 40. It depends on the size of the fibroids. If they're still small, like maybe 2 to 3 centimeters, you can do like a UFE, which is a uterine fibroid embolism. They insert pellets into the uterus and it shrinks them. You can do a myomectomy, meaning they go inside the uterus and remove the fibroids, but they leave the uterus and the ovaries. Or if they're big and bulky and you're done having children, they can just take the whole uterus out. Most of the time they leave the ovaries so that you don't go to menopause too soon. It just depends on the size of the fibroids. If you have like heavy periods and things like that, sometimes they can do like a uterine ablation. The ablation is like they basically burn off the uterine lining, so there's no more to shed. So then the fibroids shrink. The thing with if you get like a myomectomy or remove the fibroids, they do have a chance of coming back. So those are not like a permanent fix. Of course, a permanent fix is just to remove the whole uterus.
Okay. Can fibroids be prevented?
No, fibroids are pretty much, it's because of our estrogen, they're hormone driven. So, I mean, we have estrogen, so more than likely they're gonna come. So it's kind of hard to prevent to getting them. They start off small. It used to be like if you have fibroids, you got a hysterectomy. Now we're just waiting, watching them. And if they get big and start causing problems, like some women get bloated, basically it mimics a pregnancy because it's gonna expand the uterus. You have bladder issues, like you have to go to the bathroom a lot, constipation, heavy periods, and things like that. So if you have a lot of symptoms, they suggest a hysterectomy or the ablation or something like that so that you won't have a period anymore. Mm-hmm. And most of the time, if you get closer to menopause, the fibroids shrink. So that's about between ages of 50 and 52.
Okay. Now, what ages do, is it called perimenopause? Or, I guess leading into
that starts in like your 40s.
And how would a woman know if she's in that?
Oh, I'm sorry, it was breaking up.
How would a woman know that she's in that premenopausal stage?
Oh, okay. Mood swings, hot flashes. And as you get closer to menopause, your periods to kind of skip around. So say like you'll skip 2 or 3 months here and there. But 1 whole year without a period is menopause. There's this slim chance of getting pregnant as well, because I've had several patients that get pregnant because they thought they're in menopause. So be very careful.
Well, you know, I've had students that were actually menopause babies.
Right, right. So be very careful with that.
What advice do you give women who want to have children, as far as the reproductive system, and you know they may have some issues getting, you know, pregnant? Them and their spouse may have some issues getting pregnant.
Well, it just depends on age. It depends on your egg quality. The spouse has to get like a sperm count. You have to make sure that the sperm count is normal. Most like a fertility workup, they do like an ultrasound, check your ovaries. And then they have to check your comorbidities as well, because if you got like hypertension and diabetes and all that's a factor that's going to prohibit the pregnancy. So now it's age 35 and older is advanced maternal age. So the egg quality kind of decreases after 35. So younger women, you know, they have a better chance. It just depends on what other factors or medical problems that person has.
Okay. If you all have any questions, please put them in the chat. Any additional questions?
I don't see any additional questions here, Elder.
Okay. Okay, wonderful. Wonderful.
All right, if you can unshare your screen, Miss Tiffany Applewhite, I'm sorry. That would, hey, all right, here we are. Okay. That's okay. There's a question here.
Mm-hmm.
If a woman is over 75 and her daughter, mother, and sister has had cancer, should she still have PAPs? The daughter and the sister had breasts. The mother had breast cancer. I'm assuming the mother had cervical cancer.
Oh, who she
It says, should she still have Pap smears?
The woman that's over 75, or?
Yes.
Oh, yeah, the recommendation screening is over 65. To stop screening, I'm saying.
It's over 65?
Okay.
Okay, the question is,
Right.
If a woman is over
screening.
75 and her daughter, mother, and sister has had cancer, should she still have PAPs?
Oh, well, I think she should still have the Pap smears. I think that just depends on the provider. Some providers would probably say no, because I think they even want to stop screening mammograms at that age. For me, because I've screened women that's in their 70s that come from other countries that have never had a Pap before. So I've done it. Me personally, I would.
What age has been the youngest age that you have a patient who has had or heard of a patient that's had breast cancer or any type of cancers?
25, you're a woman with breast cancer.
25.
Okay. What is the preparation for mammogram?
Just before the exam, you mean? How do you prep for it?
Yes.
Before a mammogram? Okay, so no deodorant, no lotions or anything, and you just go in. It's a little bit uncomfortable. It's not horribly bad. I know a lot of women don't want to go because they hear so many horror stories about it, and they're or maybe scared of the results. But you just go in and you just place your breast inside of the machine, and they take pictures, and that's it. It's pretty simple. Just no deodorant and no lotions or anything like that.
That's the worst exam in the world. With the technology, I don't know why they have not created a way that you could do it without, putting so much pressure on the breast You know,
Yeah,
all of this
it does feel like
technology
they gotta
has,
like
you know.
pull it off.
Yeah, I mean, you can take your temperature with a no-touch temperature. You should be able to have a no-touch
Right.
breath exam. You know, I've been trying to figure out how I can create something for years so that I could be the first. I hate them.
I did not have a
But
problem.
think of,
I don't have a problem. I just don't like
really?
them. Never have.
I'm saying they didn't hurt me. It wasn't, it wasn't hard or, painful, which I was scared because that's what I heard. But at the, where I went, I hope they did it right then.
Yeah, mine weren't painful. I just think it's horrible. I think it's torture, just the whole idea, so I can understand. I was afraid, many years, and I realized it didn't hurt, but I still have a reservation about going. I'm due for one now and have reservations, but
Yeah.
somebody's going to create
I think the pap
something.
smear is worse.
Yeah.
I think the pap smear is worse than the mammogram.
That didn't, but I'd rather do that than the
Oh,
the
no.
mammogram.
The pap smear is the worst.
There's a question.
Does NP call patients with abnormal results or the doctor?
Either or, the nurse practitioner or the doctor can call with abnormal results.
When you look at the pap smear, or shall I say, when you're preparing for a pap smear, what should women know when they're going in beforehand to be prepared?
Well, I should say that they should be kind of off their cycle, maybe like a couple of days. No sexual intercourse for like 2 or 3 days. They're gonna go in. You're gonna put your feet in the stirrups. Bring your bottom down to the edge of the table. A speculum is gonna go inside of the vagina so that you can visualize the cervix. So it's gonna open, the speculum's gonna open the vagina up, and that's gonna feel like I would say a pressure type feeling. So then we take 2 brushes, one that goes inside the cervix and one goes on the outside of the cervix. So we need 2 samples, one endocervical and then outside the cervix. So that's the part that feels kind of scratchy in the side when you brush on the cervix. That's the part that's the most uncomfortable part because it feels like a kind of a scraping sensation. And after that, we take the speculum out and we do what we call a bimanual exam. And that's when we take our fingers and place it inside the vagina. And we're trying to feel, is the uterus big? Is it boggy? And that's how you can check for if you have fibroids or like an enlarged uterus and things like that. So we feel something big and abnormal, and that's when you get sent for a pelvic ultrasound.
Oh yeah, I had one of those. Now that hurts.
Uncomfortable, yeah. Then with the wand, yeah. Transvaginal.
I asked them, how do they determine the size of the
speculum?
The speculum, yes, because I think one person may have told me that I asked the size of your hips, which was ridiculous because it doesn't necessarily mean that's the size of your opening or what have you. So that was always an issue when I was younger of that, because whatever. But that's I think it's terrible.
Well, we go by if you've had children. If you've never had children, we do the small. If you've had children, we go with the medium. And if your cervix, the larger one is longer. So if your cervix is really posterior, meaning way, really far back, we have to use a larger one so that we can see. But mostly like, teenagers, we use the small one.
So what do you, why are there some uteruses that they call tilted to the back? Is that just the makeup?
It's just the anatomy. Yeah, the makeup. Some of them are tilted to the back towards your rectum. Some are tilted to the front. So it just depends. The ones that tilted to the back, it's kind of harder to visualize. So you may have to just push a little back further. It makes it more uncomfortable.
Okay. I have a couple of questions from the chat. I'm over 50 and used to get mammograms every year, but my doctor says now I should only do it every 2 years. Why is that?
You know, the guidelines, insurance companies don't want to pay. Me personally, everybody gets a mammogram every year. I disagree with the guidelines. I mean, a lot can happen in 2 years, you know. So where I work, we still do mammograms on everybody every year after 40.
Okay.
So he's probably going by the guidelines.
Okay. Once you have had, once you have a hysterectomy, should you continue to have pap smears?
Only if you've had hysterectomy for cancer, you can do a vaginal pap smear. Meaning you're just going to scrape, the cervix is gone, so you're going to scrape the vaginal pocket that's back there. Because sometimes, you know, some of those cells, I've had some vaginal paps actually come back with HPV positive. So I would recommend getting a pap smear if you've had a hysterectomy, if you had cancer. Or even still, some women, some clinic I used to work at, everybody got a vaginal pap smear just so I can get a baseline. So if you've had a hysterectomy and you're a new patient, I don't know your history, I just do a vaginal pap on everybody. I'm a little more, I work in like a high risk area, so I'm a little more aggressive than than some other offices. So, I mean, if somebody has a history of, if they have family history of cervical cancer, you know, I may do the pap every year for 3 years until they have 3 normal consecutive pap smears. You know, if they have a family history of breast cancer, I may send them a little bit earlier than normally than other people.
Okay. Is it true that if you have started menopause, you've been in menopause for some time, that you do not need pap smears anymore?
No, you still need a pap smear,
Okay.
even if you're in menopause. And if you bleed after menopause, you definitely need to see an obstetrician or a nurse practitioner. Because you're not supposed to bleed if you've been menopause for like 2 or 3 years and you start bleeding. That's you need to get that investigated.
Okay. Should women douche before?
Oh no.
No.
No, the douche, I don't even know why they still sell those. But we're never supposed to douche. No, that's the number one no.
Yeah.
No douching. They call it the self-cleaning oven. So the vagina is acidic and it cleans itself out.
Mm-hmm.
So the douche, what it does, it makes it worse. So basically, you're going to mess up that pH balance if you're douching.
Mm-hmm.
So the vinegar water is bad. So
Mm-hmm.
putting anything like soap and those sprays and all that, it's not a good idea because it causes something called bacterial vaginosis.
Mm-hmm.
So that's when you get like a discharge, kind of like a fishy smell. A lot of women get that because, you know, they douche or they may put something inside of the vagina because they have that problem. Because if they have that smell, they keep inserting things and it makes it worse. So no douching, no perfume panty liners, no perfume tampons, no perfume pads. Everything should be plain.
Okay. So when you say no soap, you mean inside?
No perfume soap.
Huh?
No inside, yeah. Nothing inside. No soap inside, no.
No soap inside. So what do you think about those? What is it? Vagisil and some
Vagisil.
and those things like they say what they say gynecologists tested or something like
recommended.
that.
I have mixed views because I still get patients that use it and still have discharge, you know, abnormal discharge. So I guess if you get one that doesn't have scents to them, some of them do have perfume in them. Mm-hmm. So, and maybe just wash around the vagina and don't put it inside the vagina. Mm-hmm. But I do get people that use it and they still have the same issues. Mm-hmm. Oh, and not a lot of, and some people sit in apple cider vinegar water. I've had some patients sit in bleach water. So, yeah. I know. So you're really not supposed to sit in hot water because that would mess up the pH balance as well. So
Okay.
yeah.
I think that was all of the questions I saw. Elder, do you see any?
No, I don't see any more questions. I think the women and the men have gotten a lot of information on tonight. That's great. With the reproductive system, let me check here, last call. Yes, I think that is all. So it has been great this evening. Thank you so much, Miss Applewhite. I appreciate your knowledge. You look so young. I don't know if you have a youth serum or what. And you're telling me, when you told me you have been into labor and delivery for 11 years and 9 years as a nurse practitioner, I'm like 20 years of service. Awesome. Did you start out of high school? Did you start in high school? You did? Oh, great. And that, you know what? If most people could start a career out of high school, I think we would have less of what's going on in the world now, because you were focused, you knew what you wanted, and that's awesome. Kudos to you. Kudos to those who are in the nursing field, to those who are in school right now, to those of you who are on, make sure you share, and encourage someone. Hey, before you know it, you can have a lot of years under your belt opening up your own practice. Have you ever thought about that, Miss Applewhite, as a matter of fact, to open up your own practice? Or
yeah, I thought about it.
You thought about it? Okay. Well, thank you so much. Thank you so much. This has been a phenomenal week, you guys. It has been phenomenal. Thank you all. Send up some hearts and thumbs for Miss Applewhite and for all of our presenters that have come out and presented on this Zoom Live. I mean, we are finding so much history, so much information, so many gifts and talents that have come out. And we appreciate you. We appreciate your essential worker, Miss Applewhite. We appreciate you, Dr. Harper Morris. You're an essential worker. We appreciate Miss Kelly Davis, an essential worker. We had all the essential workers out here, still sharing and working in this pandemic. We appreciate Bishop Trotter, who's an essential worker for the Lord. We appreciate even Miss Dawn Vicky, essential worker, because we still got to keep our physical health, our mental health, our emotional health, our spiritual health. We have to keep all of that, our inside and outside, in good tip-top shape. And so we appreciate everything that has been said. We appreciate all of the information, a wealth of information. We encourage you to go back onto our website, Sister Time Bible Study Series, our page, Watch Global Ministry, and review the videos. We have recorded everything. By the end of the week or beginning next week, we'll have everything on YouTube, will be uploaded, that you can also view. And, look out for where we're coming, where we're going, and what's about to come. Because each time, each year, every 3 months, we have something bigger, better, and brighter, something greater. Again, kudos to all of you who have served, who have helped. And I just wanted to give you guys a little more information about tomorrow. Please don't forget, 12 o'clock tomorrow, Facebook Live. We have our hot shots that are going to be competing for top cash prizes. They'll be shooting from the free throw line, the 3-point line, the 4-point line, even layups. We have teams, and we've got a girl representing the girls in the world that's going to be competing also. So that's going to be awesome. We have Team Men of Action. We have Team Takeoff. We have Team Jive. And the other team I could not remember, but it's something like Stump It Up or something, or Snuff It Up or whatever, Shoot It Up or Line It Up or something, but they are ready. I might get out there and do a little hoop. My husband, I say, point your elbow, do a little shooting myself. But yes, we'll be live 12 o'clock tomorrow. You guys just have a wonderful, wonderful evening, a wonderful weekend. Keep us lifted. If you would like to donate to support Watch Global Ministry and the mission and the cause that we do, you're welcome to contact us at watchglobalministry@gmail.com, or you can call us at 312-715-8446. Again, we thank you. God bless you and have a great evening. Goodbye for now.
Bye.